The Community Education Channel presents Community View, a closer look inside community issues that matter. It's a glimpse, a preview highlighting issues and events important to the community, bringing public perception to light on local community issues that make a difference.
Hello and welcome to Community View. I'm Melissa Anderson. You know, suicide is a never-ending issue that many communities face. Here in Southwest Utah, we are no exception. With me today to talk briefly about the problem is Teresa Willie, who is the licensed professional prevention specialist here at the Southwest Behavioral Center. Welcome.
Thank you.
You've been working on suicide issues for over 16 years. Why do you do this?
I have a passion for this work. I understand that there's a lot of stigma surrounding this issue, and I want to be able to be a part of bringing the stigma down and helping people seek help and to reduce the numbers for suicide.
And we do have huge numbers. Here, youth among the ages of 10 to 17, we have one of the highest rates in the nation. Yeah. And you have been doing a lot to help prevent that and using students to do that. You have something called the Hope Squad.
Yeah, Hope Squad's awesome. We've been doing Hope Squad in one of our local high schools for about 12 years. And now we've expanded that to 12 of our local schools with over 300 kids that are participating in that. And we teach them skills on how they can recognize peers that might be struggling. We help them understand how to create boundaries for themselves and to protect themselves. And we just give them a good understanding of how to make referrals to the school counselors and build bridges to helpful adults.
And hopefully that's been taking and helping some of the students out there. I've talked to a few of them in the past, and that training really does help. Speaking of help, there just a year ago, the state of Utah put out an app called Safe Utah, or Safe UT app. Tell me about that.
The Safe UT app is wonderful. It's a great resource where teachers or friends or students or Hope Squad members can reach out via text to a healthcare professional, a mental health care professional at the University of Utah 24/7, so that if they can text that information to someone and they will respond immediately, either for bullying or a mental health crisis or any kind of emergency. And the nice part is it goes back to an administrator or a counselor at their local school so that they can create an intervention and help that student get the help that they need.
Does it seem to be working? That's
it's
my
working.
Question. That's awesome. That's
yeah.
Great news. Now, I took a training. It was the Qpr training. And for the folks out there, tell us what Qpr stands for and what it does.
Qpr is the equivalent of CPR, but for mental health crisis. So it stands for question, persuade, and refer. And it teaches people how to ask the question appropriately about whether or not they're thinking about suicide. And then they're able to persuade someone to get help and refer them to the appropriate resources. And our goal in our county is to train 25% of our population in Qpr so that they're able to respond appropriately and efficiently in a mental health crisis.
Now, I also understand you have some other things that are happening trying to keep firearms and medications and things like that out of the arms of these youth who may be at risk.
So what we know is that firearms specifically are the number one the method that people use when they die by suicide, and that the second one is poisoning, and so, or asphyxiation, sorry, second and third is poisoning. And so we want to reduce lethal means in the community, and we're working with our local firearms community to help secure firearms when people are struggling with a mental health crisis. We also do take back days to take back our prescription medications that may be unused or expired that people have on hand that might be accessible for somebody that might be struggling with a mental health crisis. So these are some of the things that we're doing, teaching people how to lock up firearms, to store them off-site so that they're not accessible, and to dispose of unused and medications that are unused or expired.
Not only that, but a lot of these things probably have to do with accidental overdoses. Maybe they don't even mean to commit suicide.
Yeah, absolutely. They've actually termed those deaths of despair, and they've found that there's quite a link between opioid deaths and suicide, and it's hard to determine which is which sometimes. So those things go hand in hand by reducing access to medication.
Well, we thank you for all your dedication and your work and support for the community, and we're very grateful that you are there and you're willing to help and teach these kids, and so we appreciate you coming on the show and sharing the information. And if you want to know more information, I'm sure that Teresa will be willing to help you. So how would they get a hold of you?
Reach out to us at Southwest Behavioral Health Center. You can look at our website, prevention.com, or reachforhopeutah.com. You can contact us through there or find a lot of additional resources on that page.
Great. So volunteer or take the Qpr training.
Yep, absolutely.
And there's another one coming up at Dixie State in the next coming months too. So thank you so much, Teresa, and thank you for joining us today. And thanks for watching, and have a great day.